All right, well, flu season is here, reminding us all how to care for ourselves before we get sick.
All right, we're joined by an expert to tell us a little bit more about how we can keep our community safe with a new vaccine. Dr. Alinea Stevens here, Chapa-De Indian Health. How are you?
I'm good. Thank you for having us and talking about this important topic.
Of course, of course. A lot of people don't know exactly what RSV is. You want to explain?
RSV is respiratory syncytial virus, and it's a virus that affects the lungs and the upper respiratory system, or the airway.
And I know a lot of babies are affected. Why is like the seniors and the babies? Why is that?
Yeah, it really affects the most vulnerable amongst us. So it's the leading cause of hospitalizations in babies in America. And above the age of 60, if you have heart disease or lung disease, it can also give you a serious lung infection called pneumonia.
Okay, and of course you have to worry about flu season as well. So it is, because we're going into winter time. So what are you advising people to do?
Make sure you get vaccinated if you qualify. So this year we have the RSV vaccine, which is really going to help us prevent from getting an RSV infection like last year. We had pretty bad hospitalizations from RSV. So this year there is a vaccine that helps for our elderly above the age of 60 if you have those underlying conditions I mentioned, heart disease, lung issues, or a weakened immune system. And then if you're pregnant, you can protect your baby this year if you get your RSV vaccine during pregnancy.
Oh, it's safe.
Yes, it's safe and it's effective, and it protects your baby up till 6 months of age. That's when babies are most vulnerable for RSV. So it's
but there's no vaccination for the babies.
We do have a limited supply of a shot that hopefully next year we'll have more of for babies. But for now, the pregnancy vaccine is probably going to be the most available for people to get.
Is this RSV shot good for life if seniors are getting it?
We know that it's good for 2 years, and I think as literature comes out, data comes out more, it may be longer than that.
Okay, what about flu?
Definitely, you can get the flu vaccine, the COVID vaccine, and the RSV vaccine all at the same time.
3 for 1.
3 for 1.
My goodness.
Protect yourself for the season.
All right, so a little bit about Chapa-De Indian Health. We've got about 30 seconds left here. So where is it that?
We have a clinic up in Auburn and Grass Valley. Okay. And we're opening one in Rockland coming up in a couple of years.
Wonderful.
Yep. It's a tribal community health center, so it's a wonderful place to work.
I love that. All right, thank you, Dr. Alinea Stevens. Thank you so very, very much.
Thank you, Tina.
All right.